So we're going to start our next fireside chat, and it's titled The Vitality Index and Social Connectedness. I'll introduce our moderator first, Ben Miller. Dr. Ben Miller is a psychologist and adjunct professor at Stanford School of Medicine, the past president of Wellbeing Trust, a national foundation that was dedicated to advancing the mental, social, and spiritual health of our nation. He's also a 2020 Mom board member. We're very lucky to have him in that role. And over the past 2 decades, Dr. Miller has worked tirelessly to prioritize mental health in our policies, programs, and investments in America. Also with us today, coming back to the main stage, is Dr. Stuart Lustig, a national medical executive for provider partnerships at Evernorth, a Cigna company. He engages with behavioral provider groups and other stakeholders about innovations in care delivery and contracting approaches. He's also worked extensively with Cigna's clients or employers in his prior role as national medical executive for behavioral health. Dr. Lustig previously served as associate clinical professor in the Department of Psychiatry at the University of California, San Francisco. And for 2 decades, he's worked with numerous human rights organizations, has published many articles in journals, and is a nationally recognized expert on psychological trauma among refugees and the political asylum seekers. He's provided consultation to numerous school systems and is also the editor of a textbook, this is really cool, called Advocacy Strategies for Health and Mental Health Professionals from Patients to Policies. Welcome back, Dr. Lustig. And Kasley Killam is also joining us. Kasley is a Harvard-trained social scientist and leading expert in social health, the dimensions of well-being that stem from relationships, which we've heard all about this morning and today so far. She's the founder and executive director of Social Health Labs, a nonprofit dedicated to experimenting with connection and community. And she regularly advises organizations across sectors on how to prevent and alleviate loneliness as a public health issue. Killam's expertise has been featured in major outlets, like the other 2 as well, including the New York Times and the Washington Post. Welcome back to the main stage, Dr. Miller, Dr. Lustig, and welcome for the first time, Kasley. We're so glad to have you.
Thank you, Joy.
Thank you so much, Joy, and it's great to see everybody in this virtual space. Welcome again for those of you that are just joining us for this afternoon to the 2023 Maternal Mental Health Forum. As Joy mentioned, my name is Ben Miller. I'm a proud board member of 2020 Mom and honored to be facilitating this amazing fireside chat with 2 excellent leaders. I'm really excited about the discussion we're going to get into. Before we get to our leaders and give them the run of show, let me just set a brief context for today, because I think it's important. Some of this you all know, some of this you might have experienced yourself, but it really is important for us to kind of lay out what we're up against as a society, especially as the topics we're going to get into today are pretty heavy. Loneliness and social disconnection are a huge public health concern in the United States. There was one survey that we all referenced in 2018 by Cigna that reported almost half of the American population feeling lonely and left out, and 1 in 4 reported having no close confidants. COVID-19 exacerbated this issue with social distancing measures, lockdowns leading to increased isolation. I think we've all been there. We all have our own empathy and stories about that time. But research has linked loneliness and social isolation to a range of negative health outcomes, including things like depression, anxiety, cardiovascular disease, and even cognitive decline. The presence of loneliness and social disconnection in the US underscores this urgent need for us to have radical strategies to address the issue and promote social connection as a vital component for overall health and well-being. Now, ironically, we're more connected now than we've ever been before, with devices seemingly in every room, in each pocket, generations growing up with Wi-Fi coursing through their veins, networks for work, networks for friends. We got networks for everything. We're always on, always connected, but it's still not enough. Something is not working. Social connection in the maternal mental health space is classically defined as the extent to which a mother feels supported and connected by her family, friends, and community, which we know from research has been shown to positively impact maternal mental health. And there's loads of research that shows how mothers with high levels of social support have lower levels of depression and anxiety symptoms, reduced stress levels, and even just better self-esteem. So we know that the connections here are actually profound. But on the other hand, social isolation and lack of social support have been associated with higher levels of maternal stress and depression, which could have negative consequences on the mother and the child's emotional and physical well-being. In fact, there was a recent study that I looked at in preparation for today that found that social isolation was linked to 40% higher risk of maternal depression. So we must have meaningful social connection in order to promote maternal mental health, and the need for policy and investments and programs that focus on building and enhancing social support networks for moms. So this brings me to our amazing experts today. Casley Stewart, welcome. I'm so glad to have this conversation with you. You bring both very different but complementary perspectives to our topic. You all are innovative and inspirational in your charge to do more to get us connected and to improve overall mental health and well-being. And as Joy mentioned, she gave you just a snippet of the bios. You can find more bios in your app, so I'll just get them going here. So Casley Stewart, welcome. Let's start with big question number one, and I'll let you guys take this in any order you want. But the big question I have for you is, it'll also allow you to share a little bit about the work you're doing. What is your vision for where you see the future of health going? And what excites you, and what are you most passionate about right now at this moment in time in 2023?
Well, I'm happy to start, if that's okay, Casley. And Ben, thanks for hosting this, for moderating this. And Joy, thanks as always for the invitation. It is a pleasure to be back with everyone and see some familiar faces as well as a lot of new folks in the audience today. We are huge supporters of 2020 Moms work, the vision, the purpose, all of the advocacy, of course, that this great organization does. And certainly bringing people together is hugely important to all of our work. So I think a big part of our vision in healthcare at this point at Evernorth, which is a Cigna Care Group company, as Joy mentioned, is making sure that people get to the right care at the right time. And there are a lot of different pieces to that, obviously, but we want to be sure that people are able to navigate to care. And that's particularly important for behavioral care. I think most of us, if we break an arm or break a leg, we know where to go. But if we're feeling depressed or lonely or anxious, or we're not sure about what to do with the stress of a new baby coming, whatever the case may be, we don't necessarily know where to go. Is it a therapist? Is it a psychiatrist, a coach, a peer support? Is there an app for that? So navigation is really a big piece of where we're going to get to make sure that people get connected with the right care. And then the second thing I'll add on is simply making sure that the care is of the highest quality. A lot of the work that we do in this space is not as, let's say, measured as it should be. That's something that we, I think, talked about on this main stage before. So making sure that we are getting to care that is truly delivering the results that we needed to deliver. I think that's one of our biggest challenges in medicine, certainly in behavioral care as well.
Well, thank you, Ben and Stuart and everyone for taking the time to be here today. I'm so thrilled to be having this conversation with you all. Ben, I love this question. What am I most excited about? What do I think is the future of health in this country? I believe the future of health is social. And it sounds like this is building on a theme that's come up a lot so far in today's sessions. If we zoom out and think back in history about more of how healthcare and our understanding of public health and health in general has evolved, we started out not even realizing that diseases were infectious and that they could be passed from one person to another. We believed that smoking was totally fine and not doing anything bad to our lungs. Our understanding of health is continually evolving, and we're at a point where we really understand physical health quite well. We know that exercise and nutrition and sleep and all these different ingredients are really important to that. Increasingly, mental health is part of the mainstream. I'm a millennial. Everyone I know goes to therapy. It's just like going to the gym. It's not a big deal. I can't say that about my parents. That's new in recent decades, and that's a wonderful development, that now mental health is such a part of the conversation and a part of the mainstream that I have no qualms talking about that with my friends and peers. I believe that moving forward in the coming decade or two, increasingly the conversation is going to be focused on social health. And what I mean by that term social health, I think it can be used in different ways, is really the dimension of our well-being that comes from relationships, right? If we think about physical health as mostly being about our bodies, that's of course an oversimplification, but I think we can get on par with that. If we think about mental health as mostly about our minds and emotions, kind of at the core, social health is really about our relationships. And I think what's so important here is that if we're taking care of our bodies and we're taking care of our minds and emotions, we might still feel unwell if we're not having those meaningful connections with friends and family and neighbors and coworkers and so on. So the focus of my work is really advancing this idea. And I believe, for all the reasons that Ben laid out, this is core to the conversation on maternal mental health and healthcare more broadly. Supportive relationships are absolutely essential for patients of any kind and for all of us to live long, healthy, flourishing lives. So I'm excited to be diving into that with all of you.
So Casley, I want to stay with you for a second because you've taught me a lot the last couple of years that I've got to know you and your work. And one of the things about social health labs that's been really impressive to me is your investment into the places that most of us would have ignored. Your recognition of innovation that just springs forward, that you say, you know what, if they just had a little bit of help, a little bit of cash, they could do so much more to bring their community together. And I'm wondering, and not to put you on the spot for a second, but I just want our audience to be able to hear some of these stories. If you could maybe think of one or two examples of some of the investments that you've made that have really led to much more of that vitality and flourishing in communities just by having a little bit of resource that helps bring people together.
I would love to. And Ben is being humble, but he's a big part of this program as well. The Wellbeing Trust was our first funder. So at Social Health Labs, we run what's called a monthly microgrant program. So each month we give $1,000 to a community connector somewhere in the US who has an idea at the local level to bring people together and build relationships and build community ties. And these can be very simple things. And I know from the research, from having studied this for years, that simple things like an act of kindness for a neighbor or a 10-minute phone call have measurable impact on loneliness, for example. And coming from a public health background, I really believe that we need systemic change, right? I studied solutions for loneliness through the lens of public health at the Harvard School of Public Health. And my whole ethos was we need to combine technology and healthcare and architecture and all these different lenses to have top-down change to create the conditions for social well-being. At the same time, the examples that I'm most inspired by are at the individual level from the ground up. And so this microgrant program is really about recognizing individual leaders in their communities who are just everyday people, who aren't doing this as part of their day job, but are doing this for fun. And because they see a need and they're willing to take it on. So there are so many beautiful stories I could share. We've been running the program for 2.5 years now. There's Sydney in Colorado, who was 7 years old when we gave her the microgrant, and she brought together all the kids in her class to form a kids council for the local clinic and create cards supporting the pediatric patients who were there and create kind of a community around rallying around these kids who were sick and going through a difficult time and making sure that they felt cared for. We could talk about Nadine in Florida, who decided to refurbish and replenish this communal courtyard area in a Title I school that was completely dilapidated. And she brought together the community, and they had this big volunteer day where they transformed the courtyard into a beautiful shared space to show the kids that they were valued, to give them an area where they could gather and convene, because the physical places that we have for connection matter as well. I think about Richard in Indiana, who's in his 80s, who brought together his local community, his neighborhood, and invited everyone for an intergenerational gathering with costumes around Halloween time, so that younger people and local students could get to know older people and really connect at the neighbor level. There are so many stories like that that have come out of this initiative. And to me, it's really important to recognize that that is part of healthcare too, whether or not we think about it that way. That is the preventive asset that is being built up so that those relationships go on to have downstream effects on people's health in the long run.
So well said, Cassidy, and thank you for sharing those stories. I think it's helpful to put some examples out there for people to see how it doesn't take a lot. It doesn't take millions and millions of dollars to do very basic things that can lead to connection. Now, yes, we need to transform the system, and we'll get to that in just a second. But I think you've got a really amazing opportunity to share a lot of the stories that you've been collecting to inspire other communities to do something similar. So, Stuart, I want to flip to you just for a second because, yeah, I'm an academic and I love data. And one of the things that I know you've been a part of is this vitality index. I'm wondering if you could just take a couple of paragraphs and tell us a little bit about that, what that means, and what you've found through some of the data that you've been observing over the last couple of years within that index.
Yeah, absolutely. And starting with our mission, which is to improve the health, well-being, and vitality of those we serve, we really, as Casley was saying, see health more broadly. It's just what happens in the doctor's office or even what happens in your therapist's office. And yes, we all have therapists, and that's probably a good thing for most of us. But that said, there's more to it than that. And so the work that you alluded to a few years back, Ben, around loneliness that we did, it was exactly for the purpose of understanding this huge social construct, which does cause an increase in depression, does cause an increase in anxiety, heart disease, and brings people into the emergency room when they otherwise might not, if for no other reason than to have a connection. And so we've pivoted at this point to really understand health more broadly as well. And vitality, we really see as the next generation health measure. It certainly does include some health components, but vitality is essentially the ability to pursue our life with energy and with strength. And there are several components of it. So autonomy is one of those, being able to do things independently. Competence to do those things well is another part of the construct. And relatedness, importantly, I think for our conversation today, is the third element. And those domains span multiple other areas. So there's physical health, emotional health, but also financial well-being, spiritual well-being, economic well-being, connectedness with other people. So it's a broad measure, and what we found in using this measure, and with a survey of about 10,000 people across the country, ages 18 and up, is that vitality was optimal on a 100-point scale in about 17% of the people that we surveyed, and was at the lower end of the spectrum in about 20%. So most people, it's kind of a bell curve distribution, right? Most people are in the middle, but there's room for improvement in 80+% of folks that we surveyed. I'll just leave you with a couple other data points at the moment, and we can always delve more deeply into this too. But vitality was highest for those who were older, which was fascinating because on the one hand, if it was just about health, you would expect it would be highest in the younger cohort. But similar to our loneliness research, we found that as people aged, they got more and more vital, just as they got more and more lonely. And I think important for this group to understand is that in general, men seem to have higher vitality scores than women. And we can drill down into that a little bit further later on. But those are some of the big picture findings and why we're interested in vitality as an enterprise that's dedicated to people's health and well-being.
That's great. Thank you, Stuart. And so a question for you both, just building off of the unique perspectives that you each have. I want to talk a little bit about the audience who we're in front of today. We've got payers here, we've got policymakers, we've got providers, we've got other partners. When I think about your unique vantage points on both the problem and the solution, I'm wondering if maybe each of you could just describe a little bit about what action steps you feel like you would recommend to any of these important groups to really help us better address social connection, mental health, and overall well-being. And these could be anything from, like the previous panel, making recommendations specifically to a payment model, all the way down to something as nuanced as doing more micro investing in community. So I would love to know what action steps you think our audience should take based on your unique perspectives.
I'm happy
Go
to
ahead.
start if you'd like.
Sure.
So certainly from a payer perspective, because that's the world in which that I inhabit, there are multiple opportunities, and some of these involve identifying social determinants of health up front and center, which we now do. By the way, when people call us for whatever reason, that's an important screening point, because it may be that someone is quite isolated, is lonely, or doesn't have the capacity for one reason or another to get in to see their healthcare provider, or even before we get to that, buy groceries, right? Or they're having trouble taking care of someone at home, whatever the case may be. So that's something that we do on the health plan level, but certainly providers are doing this too, or they certainly should be doing. All of us can do this as well. Just in passing conversations with folks that we have with our friends, our colleagues, our loved ones, how often do we really say to someone, how are you today? And stop to really listen and reflect on when someone may not be doing so well, and to try to fill a gap perhaps, or to lend an ear for a little bit longer. So we of course have coaching, case management programs where we are doing active outreach to screen for these sorts of social problems, as well as the physical and mental health problems as well. So that's a big part of it. But really, it takes the perspective, I think, to identify, as you've done, Kathleen, in your work, that these are real issues. And that they do need to be inquired about, followed up upon. And I will say in closing here that one of the things that we found in our earliest work on loneliness was that the antidote was face-to-face time, meaningful face-to-face time in person with other human beings, particularly those human beings that you care about. So we could probably all use more of that, especially as many of us are working from home these days, as the case may be, or sitting in front of screens. So gathering like this, better than not gathering, and yet in-person gatherings are really, I think, where it's at for our overall mental well-being.
Yeah, that's great, Stuart. Plus one to that. I would add to that, I think the first step is really deciding that this is a priority, and the evidence is there to support it. There was one study in 2017 that came out by AARP in partnership with Stanford and Harvard that examined Medicare spending data, and they determined that isolation among older adults costs the federal healthcare system an extra almost $7 billion each year, right? And that's just among older adults. In fact, the data shows that younger generations are even lonelier. So I shudder to think how much that is going to cost us as a society down the road in terms of the ailments that sense of disconnection is going to lead to. Investing in social health, investing in our relationships, and innovative ways to cultivate them as part of the overall health ecosystem is a prevention strategy. It's going to prevent those costs down the road. And there are a lot of really innovative startups and nonprofits and programs that are cropping up to do exactly that. One example that I am excited about right now is called Our Roots, which is a virtual peer support platform for mental health that's built by, with, and for under-resourced birthing people of color. And I believe Priya Iyer, who's the founder and a brilliant epidemiologist, is part of today's conference, so be sure to connect with her. What I love about this example is it's mental health through social health, right? It's building these peer relationships, supportive peer relationships, and a supportive community so that new moms don't feel alone when they're especially at risk because they're experiencing poverty or because they're a person of color. And so by building that social health resilience and that social health strength, it's also benefiting their mental health and their physical health. So, I think investing in things like that is really important, and partnering with programs like that to implement them and pilot them and build out the data even further. I would also say that for providers, there's a huge push toward what's called social prescribing. So this idea of writing a prescription, not literally, but figuratively writing a prescription for connection or for exercise or for nature, things like that. And the Social Prescribing USA, which is an emerging organization here in the US, is partnered with similar organizations around the world who are sharing insights and really implementing this in a healthcare context so that doctors and nurses and counselors and social workers are really starting to pick this up as a practice so that when they identify that a patient comes in and may not have supportive relationships to drive them home from a surgery or to help them figure out their medication schedule, that they're able to plug them into local resources and programs to start building out those relationships. So I would say that's kind of something to keep thinking about. And in the book that I'm writing currently, I'm a few weeks from my deadline, so peak stress, but I explore a lot more examples of how we as a society in healthcare and other sectors can really be thinking about this and embedding it in all that we do, so that this is part of our culture and not just siloed efforts to create connection.
I'm really glad that you mentioned culture, Cassie, because I want to ask you both about this. I mean, essentially, when I listen to you both talk, you're describing in some ways a new paradigm for health, a new way to approach this, a new construct, have you. But standing in the way of that is our culture and our structures. And I mean, we've all inherited things in the health space that we know don't work. And I think that this inheritance can be challenging for the best of us. I mean, we know that having the wrong structures or the wrong cultures can impact individuals, communities, and entire societies. I mean, when we inherit this culture that's not effective, we face a variety of barriers and obstacles that really keep us from achieving a lot of the goals that I think I'm hearing both of you describe. I mean, I've seen firsthand outdated beliefs and practices that are no longer relevant to the modern world, or cultural norms that are frankly harmful for some communities. And needless to say, but these faulty structures and beliefs, they're perpetuated by folks who maybe don't intend for it to be this way. They might have a different way of pursuing the world if someone could just help them move that along. And so we got to change this. We got to change the structures. We got to change the culture. But that requires things to get a little bit messy. It also requires trust. And so I'd love for you both just to talk about this for a second, because if we are going to change our culture so that it's more inclusive of community, it embraces more of these concepts, broader concepts of health, then we really do need to reconnect on things that matter. And we have to create new structures for that. So how do we do this? What are your thoughts on the issues of culture, of the issues of structures, and how we might be able to refine a new vision that modifies both of those? That's a big question.
Yeah, I can handle all of that in 1 minute, but I don't know what we'll do with the rest of our time. But in all seriousness, I think Edelman is a firm that has a trust barometer. So I wanted to pick up on the theme of trust. And one of the interesting things about the trust barometer is it found that people tend to trust their employers. So the government is variable. There are other actors out there, but people in general tend to trust their employers. And so this gives a huge opportunity for employers to step in. And many of them, of course, are in the healthcare space, right? If they're taking care of their employees. And so one of the interesting things that we found with the Evernorth Vitality Index that we've developed, and there's a 5-question version, a 10-question version that I think has some bearing on the work environment, is we compared working moms to working non-moms, women who are working who are not mothers, as well as mothers who are not working. And interestingly, there was something protective about being back at work, particularly if you were a mother. So there was, and this is in the culture of us telling people they have to get back to work really quickly. We always think of that as very stressful, particularly if maternal leave or even paternal leave is short. But what we found is that working moms tend to have more vitality. Their vitality scores are higher than each of the other 2 categories. Now, there are some other nuances there. They are more stressed about work-life balance, for example, and feel like they're running ragged compared to the other 2 categories. So women who are not mothers, or mothers who are not working. But I think it tells us sort of where the action is. So employers can do a lot. And I'll say also, just in closing here, that we also found that vitality was, those who were more vital, who had higher vitality scores, tend to enjoy their jobs more. They were more satisfied, they were less likely to quit, and they were less lonely too, which is one of the constructs that we get to with vitality. So a lot is going on, I think, for employers to be able to interact with folks to improve vitality, to improve healthcare. So the culture of the workforce, I think, is particularly important to your question, Ben.
Yeah, I absolutely agree. I mean, again, I will say that we need policies that support this. We need providers and payers and partners and everyone to be taking this on. And we also need to recognize that each one of us, each of you listening, watching right now, is a child to someone. You have parents, you might be a brother or a sister, you might have children and be a parent yourself. You're a cousin, you're a friend, you're a neighbor, you're a coworker, you're a manager. Whatever roles you live your life each day, those are opportunities and relationships that you can infuse these principles into. So whether it's working with patients or working with your coworkers or calling a friend or saying hello to a neighbor, every interaction that you have is changing the culture, whether we give it that credit or not. And so I think that, we're never going to change the systems and our institutions unless each of us is taking that ownership on in our own individual lives and treating other people with kindness and showing other people that we care. That's essential, or we're not going to change the culture.
One of my mentors that I had always taught me the importance of language in these conversations, how language changes our culture. And I always got so frustrated having these conversations with him because when we want to talk about mental health, we have to name it. We have to say mental health. But when we really want to describe this culture that we've all described today, it's bigger than that. Mental health is a foundational piece to it, but it's bigger than that. You could call it well-being or vitality or whatever. It's bigger. And so we have to really be, conscious of the language that we use so that it doesn't reflect kind of the antiquated structures that we're trying to change. And so I'm always just thinking that in the back of my head, and I don't have any good answers for it. Because, I one of you made this point earlier, but years ago, we used to just try and get people to say mental health. Just say it. It's okay. Just say it. And now people say it all the time, Casley, to your point about the next generation. And now people want to know what to do about it. And I feel like that's a huge paradigmic shift for us all, but the language is still kind of catching up. So I've got one more question in the remaining time here. And this is, you could take this any which way you want, but we talked a little bit about the action steps that people can take. But I want to focus in on us as individuals. And each of us may have a role as with our employer. We may have a role within our family unit. We may have a role in our community. I want to talk just briefly about what's one step that individuals or communities could take to really foster greater social connection. And how could we ensure that those abilities to have better social connection are inclusive and accessible to everyone, regardless of background or circumstance? They don't need to have fancy degrees. Let's just make sure that we allow people all the chance to do that. So what's one thing that we could all walk away in our respective worlds and just go home or go back to work and do to foster that social connection?
Stuart, you're on mute. Do you want to go first, though?
Thank you. I'll answer that question geographically. I think it's all about where do we have spaces to congregate, whether it's in the community, a park, a restaurant, a cafe, or even in our own home. Do people congregate in the kitchen? Do they congregate in a living room or a backyard? Where are those spaces? Because if we can provide spaces at whatever level, people can come together.
I love this question, and I want to tie it to what you were just saying earlier, Ben, about the language we use really matters. I've spent a lot of time in kind of the world of social isolation and loneliness, and the reason I'm so passionate about social health, it also relates back to something that I believe Cynthia was saying in the previous panel about shifting from just focusing on addressing the negative to cultivating more of the positive, and to not just fixing the deficits, but also to building up the assets. That's why I'm so passionate about the idea of social health, because it shifts the conversation in a really positive way. So my recommendation for what each of us can do as a takeaway is to volunteer. even if it's a super simple something you do in your immediate neighborhood for one afternoon or for a few minutes, something you do to help a friend, any act of service for another person. Because related to this idea of framing, it takes the attention away from you and perhaps you're feeling lonely or socially anxious or whatever it is, and it turns it to the other and creates an asset and a relationship and a connection point that gets you out of that frame of mind. So that would be my one suggestion.
Yeah, so you saying that reminds me of just a brief story, and I have to say it quickly. A couple of years ago, I was invited to participate with a spiritual leader that came over from India. And he was sitting with a group of thought leaders, and we were allowed to ask him questions. This is a man who's very well respected in his field. And, we could bring to him, just get his advice or wisdom on certain things. And at the time, I was doing a lot of work around despair, looking at why people are dying prematurely to drug, alcohol, and suicide, and wondering, like, what do we do to change these trends? I mean, they're going in the wrong direction for too long. And so I laid out the case and I said, what do we do? And he basically said what you just said. He's like, you find people, what both of you just said. You find people, you give them something to do together in a place that they are together. And I think about that all the time. I know that's like so simple. It needs to be a bumper sticker that's probably, some AI can generate better than I can. But there's something powerful about what happens when we allow ourselves to enter into service with one another. It benefits us, it benefits them, it benefits the collective. And there's something that just is radically game-changing about that it far is outside the walls of the clinic, far outside the walls of, what we're going to create policies around, but yet meaningful. So I guess my challenge, and I guess this is moderator's, privilege here. My challenge is for each of you to do what Casley just said and what Stuart just said. Go to those places that you're already hanging out with folks. And I bet you tonight, each of you are going to have dinner at a dinner table with some family. Start there. Ask the question. What is it that we could do to better serve our community, to help others around us? What is it that we could do to help each other, even in our own family unit? And I bet you the conversations you have are going to be very different than the conversations you usually have with anything like my house. It's, arguing over what we're going to do after dinner. So that could lead to this other opportunity for us to really rethink how we approach health. So Casley, Stuart, I want to thank you both. Thank you for your leadership. Thank you for your wisdom today, offering it up to us in this audience. And I wish you both the best in your continued work. Joy, I will turn it back over to you, my friend.
Wonderful. Thank you so much. I'm smiling ear to ear because isn't there research that shows that you get a dose of dopamine, whatever the love hormone is, after you volunteer and help someone? And it's so true, and was a big part of my life personally. So that was a great way to end. And then one other point that really struck me is, don't several other countries use something like a vitality index to measure, versus the GDP, to measure the health of their nation? And just want to thank all of you for an amazing dialogue, and perhaps there's some policy levers around the use of the vitality index here as well.